So, Dr. Alok Pareek, how do you approach and treat cancer?
See, before answering this question, I will talk a little bit about how I approach the diseases. Looking at cancer, I take it as any other disease. And I do not give any special importance to this disease because I feel that every chronic disease needs an important attention. And for me, cancer is like any other chronic disease. When I saw homeopaths treating cancer, I found and I saw that they were very, very slow in treating those diseases, and the pace of the disease was moving very fast. I thought we have to work still harder to achieve our goal. Good, it is a chronic disease, but chronic disease sometimes becoming subacute, sometimes even becoming very acute on chronic surface. The traditional homeopaths were treating it just as a chronic disease with a single dose, with a lot of labor, but the results were not satisfactory. And so my approach to the disease cancer was both as a chronic disease and as an acute flare-up of a chronic condition. And so I resort to chronic constitutional antimiasmatic remedies, the polycrests. At the same time, I started taking help from acute remedies. And the acute remedies were the so-called clinical remedies and the organ remedies. And when I worked sincerely, laboriously with those remedies, I found wonderful results. And I found that the suffering was lessened and we could not only stop the progression of cancer, but many times we were able to achieve the regression of the disease.
So, in your experience, to which extent does the emotional fact, the emotional state of the patient increase the development of a chronic disease, let's say here cancer, because we are in the Cancer Congress, and to what extent do hereditary factors play part of?
Good. First coming to the mind. Mind is all important in chronic diseases and even in acute diseases, many of them. Leaving aside those acute diseases which are caused by external conditions. The basic difference between human beings and animals is the mind, the thinking, the rational mind. So we believe cancer starts not just in the body, but in the mind, in the thinking. And hence, we have to study the subconscious mind of the patient. Now, the subconscious mind is like a chip of a computer which stores, and we have to open up this storage capacity of that chip of the computer, the subconscious mind, the memory, the fears, the suppressions of emotions, the suppression of feelings, the beliefs, and the past experiences which are stored there. When we open up the subconscious mind, we get so many things and we find that they were responsible for this cancerous manifestation. And when we are able to overcome these morbid mental phenomena with our remedies, we get very good result. Coming to the second point of your question, hereditary plays a very important role in treatment of cancer. No cancer is caused in one generation, remember. No cancer is caused in one generation. It is carried through generations and generations and generations. Anybody who gets cancer in this life is definitely provided with a taint from previous generation. And also could be generation still before. So it is important to go to the hereditary factors. And this we study through the Hahnemann's miasmatic theory. So miasms are basically the tools, the living tools which give us the hereditary influences.
Mm-hmm.
And coming to the modern oncology, they are using the word now oncogenes.
Mm-hmm.
First genes and then further coded to oncogenes. And they believe that the oncogenes, they carry the trait of cancer. But we have been believing in this now for 200 years in the form of miasm. Miasms are more living, they are more of energy nature, and they are more broad. The oncogenes are limited, they are coded, they are molecular. And through the study of miasm, we study the depth of the genetic inheritance which we have got, which is very much responsible for the phenomena called malignancy.
Mm-hmm.
So in my practice, I try to hit out at this phenomena. I try to go to the root of this phenomena. And the study of miasm helps me to give a living picture of this inheritance,
Mm-hmm.
how it has come. Not only the inheritance in the moment, but how it has come.
Mm-hmm.
I get the idea. And then I go for the remedy. So I give importance, a great importance to your question, because I give in my treatment great importance to the mind, to the thinking and analytical mind, to the emotional factors, and to the inheritance through generations.
As far as I understood today, you treat some patient only homeopathically, and some you treat after surgery, and some you treat together with conservative medicine like radiotherapy and chemotherapy. Share some observation, some experience. What do you prefer? What do you think? What do you like mostly?
So, to be very practical, we get very little direct cases. Majority of the cases are either post-surgical or post-chemotherapy or post-radiotherapy. Majority of the cases. Well, when I thought, if I keep waiting for just direct pure cases of cancer, which are the ideal thing for me as a homeopath,
Mm-hmm.
then I will keep waiting and waiting. Then I said, okay, let us get into this venture of post-chemotherapy cases and post-radiotherapy cases and post-surgical cases. Let us see how homeopathy works. And we found wonderful results. We found that not only patient was getting better with the original disease, but he was with homeopathy, he was even getting rid of the toxic effects of these modern adjuvant therapies. And so homeopathy became more and more popular.
Mm-hmm.
Coming to your question, this was just the parallel side of the answer. Now coming to the main answer, yes, I do advise surgery at times. Yes, and after surgery I give homeopathic remedies. I am not one of those homeopaths who just stick to the remedy. There are cases in which there is a life-threatening obstruction. There are cases in which there is a life-threatening pus formation. There are cases where the tumor bursts and there is septic condition all over the body. Now these cases need cleaning up surgery. These cases, for example, there is an obstruction caused by tumor of the head of the pancreas. The patient is suffering from obstructive jaundice. The serum bilirubin is going higher and higher and higher. Now there is a mechanical obstruction caused by the tumor. I would like it to be bypassed by surgery.
Mm-hmm.
Then my remedies will act better. If there is a stone in between my flowing water, I would like that pebble to be thrown away so that my water can flow more freely. I am against surgery which is not needed. And in the present scenario, surgery is being done luxuriously like for anything. I am against that. I am only for that surgery which is causing obstruction to my cure and causing immediate threat to the life of the patient. I like that surgery which takes away the immediate threat to the life, and I give my remedies along with that. Coming to chemotherapy and radiotherapy, now that is a problem. Most of the patients come along with it. Most of the patients want homeopathic remedy along with these therapies. I cannot say, no, I cannot give homeopathy, you go away, because you are on these therapies. I cannot.
And
so
you cannot decide for
yes.
them. Yeah.
So I thought, okay, you continue with your therapies, and along with this I give homeopathy, and it has given me two benefits. Number one, patients' confidence develops in homeopathy. Number two, homeopathy takes away the toxicity of these therapies. And many a times we have seen that positive effect of these therapies along with homeopathic remedies.
Yeah. But you don't do it in your hospital, do you?
No,
No.
never.
Yeah, okay.